What is chronic traumatic encephalopathy? Here is a slide right off the web. Look at this healthy, normal brain. We see nice, tight sulci, plump white matter and gray matter. Now look down below. This is a cross-section of a CTE brain. First of all, notice the deep fissures. Look at these. And the deteriorated white and gray matter. It didn't say, but one would surmise that this is an advanced case, and not at all one which would be defined as mild cerebral atrophy. September 5th, 2012. Bill's headache was at a level 5. Our intervention proceeded with more personal problem solving and working on his memory. He actually had been keeping his daily log and had found a pattern of stress, pain, and lack of memory being related. He also was making entries in his good ideas and spiritual thoughts sections, but I wasn't sure if he was using these sections outside of treatment. We continued with the discussion of the links of pain, stress, fatigue, and memory. I introduced the topic of brain rest, taken from Jill Bolte Taylor's book, My Stroke of Insight. She speaks about taking 90 seconds and consciously moving the awareness to the right hemisphere, which she refers to as la-la land. 90 seconds, that's all it takes to start a mood change and stop negative thoughts.
Empathy, a special empathy. The player has conditioned his body and mind to fight off pain, all pain, to achieve the objective. Most of all, the groups that I've talked to, different people with head injuries, all volunteer that their shortcoming or their perceived shortcoming of denial is present. They all seem to say, it took me a year or so to accept. Meanwhile, they're fighting against all the changes in his or her behavior. It's like you're not in your own skin anymore. These negative behaviors are making your life miserable. The people close to you are not immune to the negative behaviors.
Here's another look at Bill's toolkit. He used the schematic bullseye drawing to visualize barriers which kept him from normal functioning. This helped him to problem solve. With the bullseye, Bill could see the barriers which blocked the goal of normal functioning. His task was to cope, reduce, or remove each barrier. He developed the strategy, always have a game plan. He learned he must constantly employ coping skills. He identified on his bullseye the barrier of ruminating behaviors and thoughts as one of his more imposing negative behaviors, and so he developed a strategy which he called get out of crazy loops. He gave himself plenty of tools to stop these loops. Remember? He got the attention of his itty-bitty shitty committee and ordered it away. He also used tangible tools, such as a whistle, to remind him to just stop his behavior, or a buzzer in his pocket to remind him to be present and offer a prayer. Another positive tool for getting out of the crazy loops and to change his mood was the use of imagination. He learned that thinking about other more pleasant things, that is, things he'd rather be doing, helped the situation. Or one of his more favorite tools, a real mood changer and pain distractor, was singing good old 60s tunes. He had more tools. He wrote about his feelings. He joined support groups and developed friends. He knew his research project about serial concussions and CTE was going to be a contribution to this course. Knowing he would be part of stopping the carnage and getting the word out, gave him a full sense of accomplishment.